want to talk to you now about another thing that was in the governor's budget, and this is to provide research for medical marijuana. It would go for 20 hospitals.
Yes.
Why don't you explain how this would happen and how they could do this with the conflict of interest with the law enforcement?
Well, at the federal level, marijuana is still #1 prohibitive drug. In order to have a license to grow marijuana and to do research, you have to get a license from the DEA.
Right, it is a process. You need to be approved by these federal government agencies to acquire research-grade marijuana grown by the National Institute on Drug Abuse. So how far is New York from prescribing medical marijuana to patients, and who figures out which conditions benefit from the drug?
What the governor is trying to do under the auspices of the Department of Health is for those patients that are suffering with cancer and debilitating diseases that the use of marijuana can ease the pain. And I've talked to certain people in the medical profession, and it's a mixed bag. Some say we have drugs to do that. You shouldn't have to, give them marijuana. But sometimes, you have to weigh this. You don't know if they're talking to protect the pharmaceutical industry, which they have close ties with. But, I have patients come to my office, patients that are paraplegics that suffer every day. And I've had patients that have been inflicted with cancer, and they say it's the only thing that works. So I, for one, would allow the use of marijuana for medicinal purposes under the supervision of a physician and in a hospital. There is a movement by Senator Savino. She's put out a bill calling it the Compassionate Care Bill. And it's a lot broader, and it allows a nurse or a physician's assistant to do it. It's only a licensed patient that can go in a legal dispensary store that could access it. There would have to be a patient list. They would have to sign their name. Everything would have to be certified. I'm not sure if that has traction yet.
The new regulation Governor Cuomo is proposing for New York would not go as far as legalizing marijuana for medicinal purposes. Its purpose is to analyze the health benefits of cannabis while controlling the potential abuse of the drug.
Whenever you talk about marijuana as a gateway drug, people fear that the youth get it and they become hooked on it and they go to more serious drug consumption on other drugs. So this was a first step by Governor Cuomo. And it's something that I think will be evolving. We're not ready to do what Colorado has done.
Right, which is to
Unlimited,
recreation.
right, that's correct.
Colorado and Washington passed constitutional amendments to legalize marijuana for personal use and tax the drug. Right now, medical marijuana is legal in 20 states and the District of Columbia. The New York hospitals that will participate in this clinical research have not been identified, and it has not been made clear how this effort will be funded.